Introduction. In this video, we will review 5 high-yield cardiology cases focused on physiology, pharmacology, and clinical correlations. Each case is designed to reinforce key concepts tested in medical exams and to help you build a stronger understanding through concise and practical explanations. Case 1: A physiology study has a diseased heart for intracellular calcium regulation. Microelectrodes placed into cardiac muscle cells detect a rapid decrease in cytoplasmic calcium level immediately preceding relaxation. The question in this case is which of the following proteins is most likely responsible for the observed change in electrolyte levels. The correct answer is sodium-calcium exchanger. Intracellular calcium regulation plays an important role in excitation-contraction coupling. Voltage-dependent calcium channels, L-type, are activated during phase 2 of cardiac action potential depolarization and permit influx of calcium into the cardiac myocytes. The final stage of excitation-contraction coupling is myocyte relaxation, which occurs subsequent to the calcium efflux from the cytoplasm. Intracellular calcium is removed primarily via a sodium-calcium exchange pump and sarcoplasmic reticulum calcium ATPase pump. Case 2. A patient that comes to the emergency department is initiating a new treatment based on his most recent laboratory results. This treatment is triamterene. The question here is which of the following best describes the mechanism of action of this medication. The correct answer for this case is blocking renal tubular epithelial sodium channels. The thiazide diuretics lower blood pressure by inhibiting the sodium chloride counterporter in the distal convoluted tubules, thereby decreasing reabsorption of sodium and chloride. Both the thiazide and loop diuretics induce volume loss with subsequent activation of the renin-angiotensin-aldosterone system. Aldosterone increases renal sodium resorption in exchange for potassium by upregulating the synthesis and activity of epithelial sodium channels and sodium-potassium ATPase pump. Because of these effects, increased aldosterone levels commonly result in hypokalemia, which can lead to muscle cramps, weakness, and, when severe, cardiac arrhythmias. Potassium-sparing diuretics may be added to prevent hypokalemia. These weak diuretic medications act in the distal nephron, where they reduce potassium excretion. Triamterene and amiloride directly inhibit the epithelial sodium channel, preventing sodium from entering principal cells. This reduces the electrochemical gradient that helps drive potassium secretion. Case 3. A 30-year-old woman comes to the emergency department for sharp chest pain that radiates to the left shoulder. This pain increases with inspiration and is relieved by sitting up and leaning forward. She was seen for a facial rash 6 months ago. She has also been evaluated for proteinuria that was identified during her last clinic appointment. The question in this case is what is the most likely cause of this patient's chest pain? The correct answer for this case is pericardial inflammation. This patient's chest pain is characteristic of acute pericarditis, which, along with her facial rash and proteinuria, is suggestive of underlying systemic lupus erythematosus. Systemic lupus erythematosus is a chronic autoimmune disease predominantly affecting women aged 20 to 40 that causes constitutional and multisystemic symptoms. Serositis inflammation is common and most often manifests as pleuritis or pericarditis. This is only the first part of this cardiology review. In the next video, we will continue with Case 4 and Case 5, covering more high-yield concepts you need to know. Make sure to check the link and continue learning with Part 2.